A gentleman came to us from Haryana. You should not delay your surgery. So this is why this is all possible. It is all possible. Hi, I'm Dr. Gaurav Singh Bhandari, Director and Unit Head at Dharamshila Narayana Super Specialty Hospital, New Delhi. Today I want to discuss you a very fine case of post-bilateral total knee replacement surgery. A gentleman came to us from Haryana who is 58-year-old and who underwent bilateral knee replacement surgery in our hospital about 6 weeks back. As you can see in the video which is being played in the background, you can see the gentleman is doing cycling in his farmyard. He's running, walking, and has been advised to start driving as well within 6 weeks after total knee replacement surgery. When someone is advised on knee replacement surgery, you should not delay your surgery to get a very fine and good results after the surgery. Nowadays, the technologies has evolved. I understand the fear of undergoing a massive surgery, but now the technology, since I've told, the technology has evolved and it is still evolving. So the surgery have become nowadays painless and the patient are mobilized from day 0 onwards. There have been instances in our case also in which a surgery was done in the morning and the patient has been discharged in the evening. That is what we call as daycare surgeries. So a lot of daycare knee replacement surgeries also are being promoted nowadays. So this is why this is all possible. It is all possible because of technologies, robotics and AI. So once again, it is very important to understand the right surgery at the right time is very important to get the best results out of that. Thank you so much.